Good morning, students. Today we are going to deal with the important topic on health education. The content of the health educations, the layout is aim and objectives of the health education, definition of health education, describe the approaches to the health education, explain the principles of health education, and explain the content of health education. Describe the approaches to the health education, explain the principles of health education, and explain the content of health education. Introduction. Health education is the process of giving information about the health in such a way that the people will motivate and practice the good health habits to maintain the individual community's health. It is an active and continuous process. Aim and objectives: to encourage people to adopt and sustain health promoting lifestyle practices, to promote the proper use of health services available to them, and to arouse the interest, provide knowledge, improve skill, and change attitude in making rational decision to solve their health problems. The fourth main objective is to stimulate the individual and community's resilience and participation to achieve the health development. There are certain definitions of health education. How can we define as the health education means what? The definition of health education is the process that informs, motivates, and helps the people to adopt and maintain healthy practices and lifestyle, advocate environmental changes as needed to facilitate this goal, and conduct the professional training and research to the same end. Health education objectives. There are certain few objectives of health education. The most important objectives are informing the people, motivating them, and guiding them into the action. How can we inform them? There are the different methods and medias to inform about the health habits and improvement in this, and different disease conditions and preventive measures through the different medias. Whereas, how can we motivate the people? The concerned people's values, we must concern the values of the people and their cultural beliefs. How we can maintain or guide the people into the action? It concerns with the people, skills and into the actions. So we need to improve the skills of the people by practicing certain healthy habits and which can motivate them to practice it. There are approaches of health education. Various approaches used for giving the health education. There are mainly three approaches. The regulatory approach, which means the legal implications we should impose while dealing or giving the health education. The government plays an important role in this particular sector. The makes the laws and rules and regulations, for example, the Food Adulteration and Environmental Protection Act. So Food Adulteration Act will prevent the food poisonous cases. So in this, the public will be made aware about the healthy habits and what precautionary measure they are supposed to take while purchasing the foods and preservation of the foods. Next is service and administrative approach. So in this, service approach is through administration approach. The health services is effective and if it is based on the felt need of the people. So here is the role of the government while planning the process of health. In the health planning process, this concerns of the health needs of the people should be taken into the consideration while planning the policies. Next is educational approach. So it is the most effective method to make the changes in the lifestyle behavior. So in this, the educational approach, education plays an important role in making the lifestyle changes. So we may have to approach the people through the educational medias. We can use the various educational medias, and through them we can disseminate the information related to the behavioral change. This was about the principles, objectives of the and approaches of the health education. Next, we will move to the principles of health education. Here are mainly 13 principles we must follow when we are building or disseminating the health education. The first principle is credibility. So credibility, it is a degree to which the message to be communicated is perceived as trustworthy by the receiver. So here, the first principle is credibility. So in this, the message which are communicated, which should be perceived by the people correctly. Okay, then only the correct message should be received by the people. So this is the responsibility of the health educator to motivate the people and make an appropriate content, select an appropriate content and disseminate the information. The interest, it is the psychological principle, based on psychological principle, that people are unlikely to choose or to listen to those things which they do not, they are not to their interest. So if the topic is not of their interest, the people will not listen. So in this regard, we must create, the health educator must create the interest among the people. So there are certain ways how we can make the topic interesting. So by putting the certain educational medias and the examples and hands-on training which can motivate the people and create their interest. Next principle is participation. So interest is also an important factor, and participation. Okay, so participation, here health educator should encourage the people to participate into the program, adopt methods like panel discussion, small group discussion, we can use it. Okay, so here you can see in this particular picture, so the small group discussion, the people should have a questioning answering session so that they can have the correct idea of health education and the content of it. Next is the motivation. The fundamental desire for learning is an individual. It is an important factor that is the contagious. So fundamental interest is the motivation. If people are, the content of the topic is of interest and based on need, automatically the people will motivate. The presentation of the content should be in such a way that people should take an interest and motivate to practice it. So we have, it is a key factor, we must have to motivate the people and then create the enthusiasm among them. Next is a comprehension. The level of understanding of the people which can be determined by literacy level of the people should be an example, no jargon should be used in this. So comprehension of the content is most important. So whatever the content the health educator is bringing or wants to deliver, it should be properly, no jargon should be used and it should be in the regional language. Reinforcement. So the reinforcement is an important factor. Okay, so repetition of good ideas. So one has to repeat first, second and third sessions. We have to conduct it if we want to make them reinforce the content. For example, during the COVID, we have seen when we are calling on the phone, so before the calling there were a continuous message, the repeated reinforced message was coming regarding the preventive measures, practicing of preventive measures for the COVID. Next is learning by doing. If I hear, I forgot. If I practice, I see, I remember. And if I do, I know. Based on this principle, learning by doing is important. So hence, we have to have a demonstration technique we can use for delivering the health education. Next principle is known to unknown. Before starting health education, the health educator must identify what is known to them. Okay. Based on them, the participant and them we give them the knowledge based on what they do not know. So if they know the certain things, don't touch that topic. First, beforehand preparing the health education, one must take the before practicing what they know, what the people know. Based on that, the further knowledge can be added to their practice. Next is the setting an example. It is most important principle, setting an example. So one must practice first for himself or herself and then educate the people. For example, great freedom fighter Mahatma Gandhi, he was the great exemplary for setting an example for the people regarding the ahimsa. So health educators should set an example to follow the others. Okay, the health educators should follow that what he want to preach. Okay, so this is what in the pictures we have already mentioned. Good human relation. Good human relation, the health educator should have a kind of sympathetic attitude towards the people and give them or help them to clarify their doubts. So in this regard, we should have a good human relation approach. Being a health nursing professionals, the communication is one of the important key factors for maintaining the human relation. Next is the feedback. This is very important to know the health educator where is his stance. So whether the content has been correctly received or perceived by the people or not. So this will come to know through the feedback. So feedback is a good tool to understand whether the participants have understood the concept of it. So at the end of the lectures of demonstration or health education, the educator must take the feedback from the participant. It must be maybe a verbal one or written one. Next principle is the community leaders. So community leaders have an understanding regarding the needs of the community people. So and their advice will help the health educator to plan the content properly. So here is important principle is community leader. We must take their views into consideration while planning the content. Last but not the least, very importantly, say soil, seed and shower. So soil is the community, seed is the information which you want to plant it, and the shower is the person giving the information. So here is like how we are planting sowing the seeds with the great help of the soil and continuous showering of the water, and with the good environment, the plant will come up. So with the same way, if our community information and the persons giving information, that is health educator, is well off with the knowledge, then he can give the correct information to the people and which will help for the preventive measures for the health disease conditions. So these were the 13 principles which we have seen. Next is content of the health education. What must be included in your health education? So there are certain aspects on which the health education should be planned and which will be reinforced continuously. So first is about the nutrition. Diet is an important factor which contributes for the prevention of the disease conditions. Human biology, yes, genetical factor, one must consider the genetical factors for prevention of certain congenital anomalies. Personal hygiene, yes, this is the basic needs of the people which can affect on the health conditions of the people. Prevention of accident, yes, nowadays because of the vehicles demands have been increased which are prone for the accident, and the new added health or disease condition, it is not a disease condition but added factors of is the accident, road traffic accident or any other industrial accident. Basic rules of prevention of communicable and non-communicable diseases. So how we can prevent the communicable and non-communicable diseases? Based on this, we must have a practice rule and which have to be communicated to the people. For example, the COVID preventive practices, which are newly trained disease conditions or eruption conditions of in the community. Mental health, yes, this is also an important. All the stages of the life, there are certain mental health illnesses among the people. So the preventive measures again for the mental health and how we can have the rehabilitation of the psychiatric patients, one must able to practice it at various levels. Proper use of health services. So there are the health provision services are being provided by the government, private sector, NGOs. So the proper use of health services should be available to them and accessible to the people, and they must be aware about the health services available to the community. Last but not least, the sex education is also important. The good sex practices must be educated or informed to the adolescent and the adulthood stage so that we can prevent the unwanted pregnancies. At the end, I would like to say the health education is imparting the helpful information to make the awareness among the public. The focus of health education is very on the people and their actions through the planning teamwork. Its goal is to make it is more realistic. The questions on this topic will be in examination will be define health education and explain the approaches to the health education. Describe the principles of health education and explain the content of the health education. These are the certain references for this topic. You can add the information or the content related with this topic with the examples. Thank you. If any questions, the students can raise up the questions. The lecture is open for the discussion. Thank you.